In this video, I'm going to be discussing about a questionnaire often used by all people in this field of sleep medicine. And we assume that we understand this. So I will discuss this in a little bit more detail. The name of the questionnaire is Epworth Sleepiness Scale. So I'm going to just share my screen to So what is Epworth Sleepiness Scale? What are the components in it? What does it really measure? How do you score it? And what is the interpretation is what we will discuss today. So Epworth Sleepiness Scale, as we said, this is a self-administered questionnaire. It is designed to measure excessive daytime sleepiness. So what is excessive daytime sleepiness? This is a condition or a situation that when you are sleepy or feeling sleepy at times when ideally one should be awake. It was developed in 1991 by Dr. John Murray at the Epworth Hospital in Melbourne, and that's why it's called as an Epworth Sleepiness Scale. The scale assesses how likely a person is to doze off or fall asleep in some 8 common situations. We also, when we talk about excessive sleepiness, we say that is it in a passive state or is it in an active state? And that's what these 8 situations will do. And we will go over it a little bit more in detail about these situations. How does it help us? You can assess any patient with insufficient sleep. That means if sleep is not adequate, if they are sleepy in the day, one can administer this. We can administer this for situations or conditions like obstructive sleep apnea as a measure of their daytime sleepiness, and conditions as hypersomnia, narcolepsy, idiopathic hypersomnia, where you can again assess their sleepiness. What does it measure? It gives you a numeric score. A number is much more easier to understand. And also it provides you a method or a baseline for follow-up and comparison. It's very quick. It was developed and designed so we can administer it quickly, and it has been validated globally. It's also been translated in numerous languages, including Hindi, German, etc. So we said, where can it be used? You can use it like a screening tool when you see a patient first time, also before a PSG. It is good tool to measure or monitor the treatment. And sometimes it's a good way to distinguish that is this fatigue or is it sleepiness? So coming to the questionnaire itself. So there are 8 questions, and each 8 question are situations, and in that you have a score of 0 to 3. So this is, and these are called Likert scale, and you can administer it very fast. So let's go over these 8 situations. First one is sitting and reading. So this is what we call a passive situation. And you again give them that 0, no chance of falling asleep. 3, just very high chance of falling asleep. Watching television, this is again passive. Sitting inactive in a public meeting, theater, or anything similar. In Indian scenarios, people have equated this to sitting like in a prayer meeting and things like that. In a car as a passenger for 1 hour, if you're sitting, then what is the likelihood of dozing off? Lying down to rest, afternoon rest when the circumstances permit, sitting and talking. Now this starts becoming more active, that one is participating actively and you can still doze off. Sitting after lunch without alcohol, in traffic while stopping a car. So these are all the situations. This is another way that you can keep it in your clinic. This is 0, no chance of dozing, high chance of dozing. And you ask the patient to give their details. These are these 8 questions, and you write the score here. A score less than 11, that means up to 10 is considered normal, and a score more than that indicates severe daytime sleepiness, which should be evaluated. There is also interestingly a pictorial Epworth Sleepiness Scale. If finding it difficult, then you can say that, see, let's take this example of reading. This is no chance. You're sitting, you're reading. Here there is a slight chance, moderate, and this is definitely you've fallen asleep. Similarly, as a passenger and lying down to rest, and you are definitely asleep, sitting while talking, etc. So this is either way you can administer this in your routine workup. What is the interpretation? We said this, that usually up till 10, we are saying it's okay, but above 11, it is definitely sleepy, and above 16 is pathological. But let's say that's up, if you say up to 8 or 10 is like a mild or a gray zone, usually just could be because of a bad night, some recent travel demands, etc. But the very high scores, you definitely need to go further and evaluate with a sleep study or an MSLT as required. So let's take this example. This is suppose a 42 years old gentleman comes to you. He says, yes, I've gained weight and I'm snoring. I'm frequently dozing off at work and while watching TV. And this is the questionnaire that he fills. And he says, sitting and reading, the score is 2, watching television, sitting inactive, 2, passenger in a car for 1 hour, definitely will doze off, lying down to rest, 2, sitting and talking, maybe occasionally, and this score comes out to be 16, definitely indicates sleepiness, and we should then proceed with the sleep study. Anything else? Yes, this has become, it's a very reliable tool. It is a good way to distinguish fatigue because sometimes the line between just tiredness and sleepiness is difficult. And you can use additional tools with this. You can use a stop bang, you can use a Berlin questionnaire, you can use a sleepiness scales, you can use a hypersomnia severity scale to assess for this. Of course, limitations are that this is subjective. So you do need to rely on the individual's honesty of filling the statements, and somebody can tell a lie. And it is a screening. So sleepiness due to any cause, it does not tell you that, oh, this is sleep apnea or narcolepsy or something. And you have to be careful when you administer it to people who are already on medications and such. So to finally conclude, ESS, as it's called, is a validated, widely used screening tool. It can be done in just 5 minutes. It's good for patients and also as a long-term follow-up. And you should use this along with other objective measures to finally give a final diagnosis. So I do hope that this has been helpful for you to understand the utility of this questionnaire, which is called as ESS. You can print it out, keep it in your clinics, or tell your staff to fill it at the first visit and follow-up visits if you want to see the effect of treatment. Thank you, everybody, for your patient listening.